To order. And the first item this evening will be a invocation by Father John Gertis. Father, please rise.
Thank you for having me here and for allowing us to do this. As we pray this evening, Heavenly Father, 365 times in the Bible we hear the words echo, "Do not be afraid." Yet there are so many who are afraid at this time in our world. It seems that even on the sunniest of days, there are many black clouds hanging low over us. So we ask you once more, speak these words to us. Tell us not to be afraid. Tell us that we can trust you. Remind us of your unconditional love and mercy. Lord, show us through acts of kindness and blessings that you have not abandoned us, but that you are truly near to us. We remember with so many this night George Floyd. May he enjoy eternal peace with you. Bless his family and friends. Bless all who grieve his death, his killing. Bless those for whom this great tragedy brings back memories of others' deaths. Bless and protect those who seek to protest peacefully. Assure them that their voices do not go unheard. Help bring an end to racism and hatred so that children one day will read about it only in history books and not see its presence on our streets. Bless and protect all those in law enforcement. During the long hours they work, may they experience moments of support and gratitude. Bless their families who worry more than families should have to, that their loved ones will return home from work safely. Continue to help us during this pandemic. Bless county workers who are putting in extra effort and hours to keep us safe and bring this all to an end. Bless our leaders, especially our county officials who gather for this meeting tonight. Place in their hearts the wisdom they need to make good and just decisions that promote the common good for all. On this night, too, we pray, Lord, protect us from severe weather and storms. Lord, we could go on and list so many more prayers and petitions. Thankfully, you know what is in our hearts, and even those things that we should be lifting up in prayer but are unaware of at this time. And so we simply conclude by saying thank you. Thank you for your abundant blessings. And so I offer this prayer through Jesus Christ our Lord. Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty, justice for all.
At this time, we'll have roll call. Cindy?
Ed Schochner,
Present.
Sean Anderson,
Present.
Bob Long,
Present.
Kathy Leaf,
Present.
Kara Cook, Tim Hall. Can you hear me? He's here. Oh, there, Tim Hall. I'll take that as a present. Paul Burning,
Present.
Rick Otino,
Present.
Bob Fiedler, Dave Osnes, Scott Counter,
Present.
Dan Hansen,
I'm here.
Scotty Ard,
Present.
Greg Telejohn, David Peterson,
Present.
Paulette Anderson. Ken, she can't get on the Zoom. Okay. Judy Achterhoff, Shelley Tomczyk, and William Peavy.
Present. Thanks, Cindy. The first item this evening now will be public comment, and I have a slip from Steve Skoglunds. Would you step to the podium, please, Steve? And you have, we're limiting to 3 minutes per comment.
Thank you. I'm a small business in St. Croix County, and we have been going through all the COVID rules and have worked hard for a couple months. Everyone has been trying to make it do and is hurting, but we were concerned about this potential county ordinance would supersede where we're at today with our own common sense, and I'm against that. Thank you.
Okay, I also have a slip from Virginia Grath. Three minutes per person tonight.
Pardon?
3 minutes.
Just, I'll read fast. Good evening, my name is Virginia Drath. I live at 1541 County Road, Owen, Emerald. My comment today is about rural water in St. Croix County and in particular Emerald Township. Emerald Sky Dairy has had 5 violations in the past 4 years. Their current permit is up June 30th, and in January they made application to double their size to 4,620 animal units, which would be 3,300 milkers. This means that there would be 38,544,000 gallons of liquid manure being spread in our township. These numbers I obtained from the application papers. DNR is telling us that permits are being pushed back and will probably go into midsummer. This past February, when our town hall tested their water, the nitrate level was 33. It should be no more than 10. A citizen on 170th Avenue wrote a letter to our town hall reporting a February test of their water had E. coli in it and sickened members of the family. Their well was brand new last summer, as well as their new home. They shocked the well, plus spent $1,300 on a UV system that will require $200 per year for maintenance. They continue to only drink bottled water due to still getting occasional brown water from their tap. I talked to them just yesterday, and they had just sent in water samples to UW Stevens Point, a cost of $135. We have a little over 200 signatures from folks in our area that respectfully request that the DNR deny the expansion of Emerald Sky Dairy until their previous fines are paid in full, and that they go without further fines, violations, or citations for 60 months. Renewal of the current WPDS permit should include monitoring wells around the facility and their spreading fields, and that more frequent inspections and closer oversight, all based on their prior violations. We are also asking for a moratorium on all CAFOs in St. Croix County until the water quality study of susceptible areas, sinkholes, and well testing is complete. I believe in transparency and would like and request that the past year's water testing results be published in local newspapers. The American Public Health Association recommends moratoriums until further environmental studies are done. Other counties in our area are also doing this. We all live in this karst geology with many watersheds. My faucets say hot and cold. They don't say Republican or Democrat. Water quality should be everyone's concern. Thank you.
Thank you. Is there anyone else who wishes to make public comment at this time? Seeing none, we'll proceed with the business items. Thank you. Okay, consent agenda. Do I have a motion to approve?
Second.
Okay, we have a motion and a second to approve the consent agenda. Discussion?
Yes, this is Tim Hall with District 6.
Go ahead.
There's only one item in the consent agenda that I'm wondering if that may be broken out as a separate voting item, and that's on the item to limit discussion in public debate to 30 minutes per item.
That's not on the consent agenda. That'll come up later with the bylaws in the business items.
Oh, I'm sorry.
That's okay, not a problem. Any other discussion?
Okay.
Supervisor Achterhoff.
Yeah, under business on page,
let me get it. You have it, Mr. Roher will be starting pending confirmation on June 8th. Is it June 8th, 2020, or is it today that we're confirmed? When is he being confirmed? That was confusing.
He was confirmed at the last board meeting. He's starts employment June 8th.
Okay.
Yeah.
Oh, okay, that makes sense, but
Yeah.
reading it, okay, that was it.
Scott, your supervisor counter, sorry.
Just had a question on item 6 on the agenda for approval of amendments to the town zoning ordinances. Is looking where those listed in the packet.
I don't think there were any.
If they're not,
Yeah,
there are none. If
that's
they are
just a-
listed, there'll be a
That's
sub.
just-
That's just a
Repeating.
placeholder.
Okay, thank you.
Further discussion? Seeing none, we'll vote at this time. And all those in favor signify by saying aye. Aye.
Aye.
Aye.
And opposed? Carries. Thank you. Okay, the county administrator's report coming up, and I believe he's also in introduction at this time.
Yes, thank you, Mr. Chairman. Before I begin discussion on the two items under my report, I'd like to introduce Adam Kostanek. And Adam is the county's new public information officer. Do you want to step up to the podium, Adam? Adam started last Thursday, last week, and we put him to work immediately. I've, never hired a PIO, Adam, in the middle of a pandemic. And then also we were faced with a scurry of activity on Friday regarding the civil unrest across the river. And we put Adam to work quickly on that. In fact, I think he communicated with the board on Friday regarding that incident. And originally I was going to have that go out from me, and I said, no, I'm going to have it come from Adam as a way of introducing himself to the board. So welcome, Adam, and I'll let you introduce yourself to the board. Thanks.
Thank you. Hi, everyone, and thank you for having me. My name is Adam Kostanek. As Pat said, I am the new PIO for the Administration Department for St. Croix County. My main goal here is to try to develop a cohesive communication strategy for the county and just try to streamline the communication processes and make sure that we're as transparent and straightforward as possible with our communication. A little bit about my background. I come from the state of Minnesota. I worked for 4 years with Minnesota IT Services in the web development, web administration, and online content management realm. And then I also have a background in video production, digital marketing, and media sales.
Welcome, Adam. Thank you.
It's a pleasure meeting all of you.
The next item then on my report, Mr. Chairman, members of the board, are the financial reports. In your packet, you have the financial reports through the end of April 2020, so that represents 4 months of the calendar year of the fiscal year, 1/3 of the fiscal year. And so we have a summary of revenues and expenditures for the 5 oversight committees. Administrative revenues are at 58%. If we look at the third of the year, we're approximately 67%. If we look at where things should be with revenues and expenditures, the administrative revenues also include the allocation for the library, which is $1.1 million of the county's allocation for libraries, and that is that's paid out. Looks like, okay, well, it's showing at 67%, right where it should be. It also includes the debt service and the internal service funds for all cost centers. For community development revenues, they're at 67%. Transportation, 74.5%. Public protection revenues at 68%. So overall, all 5 cost centers are where they should be at this point in the year for revenues. If we look at expenditures, there again for the 5 cost centers, the administration is at 46%, budget remaining, community development, 69%, HHS, 74.3%, and transportation, 86%. Let's see, and included in the administrative expenditures are library again. So we see the 1.1 million budgeted for expenditures for libraries, and we've made the full allocation to libraries. So that kind of throws off, if you're wondering why the administrative expenditures are already at 45% budget remaining, it's because we allocate the full amount for the library. Then we also show a summary of the capital improvement project status for 2020. And as I've mentioned before, we're watching expenditures and revenues for the departments this year because of COVID, and some of the actions that I've taken. We've limited hiring, any additional hiring for positions that become vacant between now and the end of the year. We're going to be scrutinizing all positions that become vacant and see if we can generate salary savings through positions that can be held vacant. Certainly for public safety positions and nursing home positions, CNAs and nurses, those positions most likely will be filled immediately rather than holding up on. But the bulk of the positions we look at will be able to keep vacant between now and the end of the year if needed. We're also looking at asking departments to reduce expenditures approximately 5%, to limit expenditures in operating expenses between now and the end of the year. And then also we're looking at the possibility of applying for grant dollars from the state and federal government for CARES reimbursement, which is the state and federal dollars set aside for reimbursing local units of government for expenditures related to COVID. Any questions at all on the financials?
Supervisor Long.
On page 16, administrative expenses, the debt service funds, looks like the budget was 5.8, and it looks like we've already spent 7.8, $2 million. I'm sure there's an explanation of that.
Yeah. Ken, do you want to speak to the debt service?
Oh, it's the refunding. So when we refunded the debt, we paid off the debt that we had, and then we reborrowed the debt. So it's showing as additional debt payment when it really wasn't. So that's going to throw off this year's numbers a little bit. I can guarantee you we're going to pay right to the penny the amount of debt that we have scheduled to pay. But the number's off because we paid off the debt when we refunded it. You're going to see an offsetting revenue in the debt service fund also. You go back up a couple pages, you'll see the refunding amount as a revenue in that debt service fund. If you subtract the two, that should be right where we're at through the payments for the year.
Thank you, Ken.
You had me stumped there for a minute.
Other questions?
No other questions, then, thank you. Well, the next item for discussion is the public health guidelines that have been issued for reopening. This is in response to the Supreme Court's nullification of the governor's stay-at-home order, which occurred a couple of weeks ago. The public health officer, in coordination with county administration, issued guidelines for reopening. These are, this is not a public health order. There is no public health ordinance affiliated with these guidelines. They are just a helpful guide for businesses that are looking to reopen safely, given the fact that the state of Wisconsin has really, based on the nullification of the governor's order, the governor and the state did not issue any orders or mandates for local public health officers. And so all 72 counties were left with the decision on how to proceed. And based on our best information that we had, it was our recommendation to issue guidelines, and that's what these are. And the public health officer, Kelly Engen, is attending this meeting remotely, and she has a very brief, I think three-page PowerPoint presentation, which will just summarize kind of where things stand with our public health guidelines. So Kelly, can you hear me?
I can.
Well, welcome, Kelly. Good to see you, and you can begin your comments now. Thank you.
Sure, great. Thank you so much, Administrator Thompson and the rest of the board for having a quick update here on status of COVID in St. Croix County. Do I need to tell you to say next slide? Okay, all right. So a couple of things I just want to highlight for everybody, board members. I realize you're getting lots of questions, and we were able to provide a new data dashboard that can be found on our website. And I'm not sure that we communicated that out to everybody, but please know it is there on the St. Croix County website. A lot of different places have been asking about how many cases in this city or town or village. We do have that data, not by town, city, and village, but there is data that you can find related to census tract on the Wisconsin DHS website. So please know that that is there. Wanted to update you on kind of our case counts and where we are at today. We do have 99 cases. Our data board does not read 99. We got 4 cases today. 52 of those are recovered, which means 52 of the 99 are not on isolation. The other remaining are on isolation and should be at home to further prevent the spread of their disease. We have 26 probable cases, and we define probable cases as people who have had close contact with a person who tested positive or live in the household and are symptomatic. That number has stayed pretty stagnant for us because of our increase in getting people tested. We are able to we've worked with our healthcare systems across the county to get testing to anybody who has, I shouldn't say anybody, but most people who have had a close contact or an exposure to COVID, which is a great thing. one of the things we do in contact tracing is identify, and I think I mentioned this last board meeting, so I'm sorry if this is a little redundant for you, but it's important to know that each positive case we come into contact, we sit down and we do a detailed interview with them. And then we put all of their exposures, people they've exposed, into risk categories. And we contact high and medium risk categories of the positive cases, and we've had 500 close contacts out of the 99 cases. We've also worked with 13 businesses specifically that have had positive cases within their facilities, buildings, or workforce. So that has been something that we do have Lori Diaby on tonight. She is our public health supervisor and also a public health sanitarian. So she's what I call the health inspector. She has been great to work with businesses and help them with planning on what to do if they do have a positive case within their business. Next slide, please. This is a chart that was designed. We're working, so I know you guys want to hear about how we work together across different departments. We utilized a GIS guy from community development, Josh Ayers, I think his name is. He's great. He helped us kind of develop this sheet about what it looks like, how many cases we're getting each day. So you can see, I mean, you kind of have to look at it a while to process it. It's a lot of information in one graph, but you can see the case counts and how they have, where they're at and how they're moving. So next slide, please. Lori, are you able to talk a little bit about our reopening plan?
Yep, I'm here.
Thank you.
You want me to jump in? Okay, so what our health advisory plan after the Safer at Home order was rescinded is we broke it down into really like 5 categories. It was recommendations for individuals, families, and community members. And then we have a section on businesses, faith communities, mass gatherings, which would be like, you know, weddings and large sporting events, those types of things, and then travel. What these guidelines do is they support businesses while they're planning to reopen to help them implement safety measures to control the spread of COVID, but also keeping the public safe and keeping employees safe. And it also ties in the importance of cooperation with public health when we're doing disease and contact investigations. They work with us very closely and cooperate during those investigations. These guidelines are health advisory. It links out to Wisconsin Economic Development Corporation's guidance, and it's broke down by different business types. I believe there's about 12 different business types that are listed in there, and then there's specific guidelines for each of those business types. These reopening guidelines were published by the governor's office in cooperation with WEDC prior to the Safer at Home order being rescinded. And so they really haven't been updated or changed since then. And then the other thing that's also been coming available now is DHS, Wisconsin Division of Health, is coming out with more and more guidance for businesses, specific business types as they're reopening. And so we're starting to reference some of those guidance when businesses have questions for us.
Thank you, Lori. I just want to highlight that today we had a call with all of Pierce and St. Croix County's hospital systems, their CEOs, including hospitals as well as clinics, to really look locally at where are we at, what is our plan moving forward. We got great feedback from all the hospitals. They did updates about where they are at, and each hospital and clinic kind of is filling a different role within the health system they work for. Some are using their hospital space as overflow for other hospitals who have ran out of capacity in the Minnesota area, and they're using their sites over in St. Croix County to use beds and be kind of a step-down unit. Others are really stepping up and helping us with testing related to businesses. And I just want to highlight that we definitely are working with everybody that's involved in the response as best we can. Schools have been asking a lot of questions about when they can get back, and we tell them, you know, your order is no longer valid after June 30th. But the one nice thing is they're very conscientious about that, and they want to do things in a way that provides least risk for their families. And so we have been in conversations with all school superintendents, as well as we're going to start a school nursing group to chat with them. We're also still in contact with our long-term care facilities. And I have to say, we're still doing a great job. Our long-term care facilities and assisted living facilities across the whole county are doing testing within their facilities and not having positives come back, which is a huge kudos to them, and really some great work being done. Some of our most vulnerable.
Thank you, Kelly. Thank you, Laurie. Are there questions from the board?
Supervisor Asnes.
Thank you, Mr. Chair. Kelly, one of the phone calls that we've been getting are where people can get tested for the COVID. And I know that you guys put on the website, I think it was May 26th, a list of some of those providers. Can you go over that for us real quick, if you don't mind?
So I think the question was, can I go over the list of who's testing?
Where people can get a test.
Yeah, so there, I do not have that sheet in front of me, but I will say our new PIO, Adam, who I just met with before this meeting, has some really good ideas on how to get that information, that one-page flyer, in a different format that's more easily readable on the website. I guess I'm hesitant to say where to go test because I don't want to seem like I'm authorizing any one particular healthcare system. I would say if you do have a healthcare provider established, check with them and see what their regulations are or what their parameters are for testing. And if you don't have a provider, check the website to see where which clinics and hospitals are doing testing. And if that is a last resort and you cannot get testing, then you should call public health. We can try to get people into testing. When testing was at the minimum, there was a lot of guidelines around testing and not a ton of testing was happening, we did a lot of care consult with getting individuals into different healthcare providers to get tested, and we'll continue to do that.
Okay, thank you.
Supervisor Otino has a question.
Go ahead, Supervisor Otino.
Yes, last I had checked that the testing was available for people who were symptomatic, and I'm curious if it's available now, for example, for myself, which is I'm in a high risk and so is my wife, but would that be available for us to go get tested?
Great question. Super, super good question. And I think most of the general public wants to know answers to that question. And unfortunately, I have to say it depends a little bit. We do know that there are clinics that are performing more asymptomatic testing, so nobody with symptoms, but yet maybe in a higher risk category. So if you have established healthcare provider, I would suggest you check in with them. and ask those questions. And then if you're hitting a roadblock with your healthcare provider, please call us because we will see what we can do to get people tested. Okay.
Thank you very much.
Supervisor Shatner.
Yeah, I see you didn't have it listed, but I'm guessing that we don't have any deaths. And if we're taking people from the Twin Cities area and then they would happen to die in St. Croix County, are they going to skew our numbers? Is that a death in St. Croix County or is that counted in Minnesota?
That's a great question, and I wish medical examiner Patty Shatner was on because she knows those rules inside and out, and I am not super good at remembering how that all works out. I will absolutely, if we start reporting deaths that are non-St. Croix County residents but happen to die in our county, we will absolutely differentiate that out so it's not painting a picture that there are St. Croix County residents dying in just because they happen to be in our hospitals.
Thank you.
Supervisor Achterhoff.
I'm just wondering if you see any time where hopefully we're over the peak. I mean, we just had, the court came and everything changed. And now with a lot of people traveling through Wisconsin and stopping in Hudson, which led to the resolution, so to speak. But do you see any sign of peak or is it still totally unknown?
Great question. I wish I had a crystal ball. I will say we've gotten, I think, 47 cases in the last 14 days. I do not see a peak or a leveling off in sight. And we expected that. We are opened back up and there is more movement. We expect to see more cases. Absolutely.
Supervisor Burning.
Hi, this is Supervisor. Can you hear me?
Supervisor Hall, I'll get to you next. Supervisor Burning is up next.
Okay, thank you.
Thank you, Chair. Kelly and Lori, I was talking with a lot of folks in my district, and they had nothing but great things to say about both of you, so job well done. One question I have, and maybe one concern I have, is we're talking about giving guidelines to reopening businesses. One portion that kind of threw me off a little bit is in my discussion, there were not very many, or there were no businesses that I spoke to inside my district who were contacted or asked to be a part of any type of reopening discussion. And I was wondering if if both of you would be open to bringing some of those businesses in. I know we're like 3 weeks in now, but I think that would be just as important as bringing schools in and other folks in the county government. What are your guys' thoughts on that, and how can we approach our business constituents to get involved in reopening and reassuring the public that they're doing everything they can to keep them safe? So I'll leave that question to you.
That is an awesome question. I love that question. And I think because of the situation we were in at the time, there was not a ton of time to prepare or plan for discussions like that. And that's really unfortunate that happened. I would absolutely welcome that opportunity. Capacity is definitely an issue. We have a pretty small health department for the size of our population, and we are putting in, and it's okay, I'm not trying to complain. We're putting in a ton of hours. And I think we're trying to figure out in our public health department unit how we best manage that so it's very seamless. Because the requests and the meetings are coming in so fast, and it is quite a large response. So I think we did also, I should just say, we did have a conversation with the economic, I'm going to get his title wrong, so I'll just say his name, Bill Rubin. Great guy. Really looking forward to continue conversations with Bill and the businesses he represents, but I would not be opposed to highlight or get a group together that looks at really safe practices and reducing risk. And I'll turn that to Lori for her thoughts, because this is really her cup of tea.
So we have email distribution list of over 500 email addresses that we have gathered over time. Some we had before COVID, some since, and it's businesses. And whenever there was a new update or something that came out from the state or a local update, we sent, an email out to all the businesses. And so we have received a lot of feedback because the businesses would reply to those updates. I too agree with Kelly. I think that if we are in the spot where we would be revising our health advisory as more of these DHS guidelines that come out now that are, additional guidelines beyond the WEDC, I think there is discussion about updating our advisory maybe. I don't know how we will melt that together, and potentially businesses could be involved with it. I know I've gotten a lot of feedback from the businesses. They all share either email or call, and lately they've been concerned that the county's going to do something different. And so they do want to be involved, so I think it would be good.
Supervisor Hanson. I'm sorry. Yeah.
Oh, don't confuse us, please. I'm sure he feels the same way. So I have a couple of questions. One's general interest. So the last time I had looked at the GIS map of COVID cases in the county, I was pleased but puzzled to see that Hudson actually was an island of no cases, at least north of 94. Is that an anomaly, or is that actual what happened? And then secondly, on a more general note, we talked a little bit about the number of cases in the county. I've received a lot of mails from constituents mentioning that we've had no deaths and low rates, so we should do nothing. But on the other hand, I recognize we're part of a larger regional system for both healthcare and population moving back and forth. You just have to go to downtown Hudson on Saturday evening, and you can see that this isn't just a St. Croix issue. We have a lot of Minnesota plates. Are we factoring? I'm sure we are, but how are we factoring, our capacity in with the stretch system in Minnesota right now?
So let me take your second question first, because it's a really good one. Deep breath though. So regionally, we have been trying to work together with local health departments to say so we have this healthcare emergency coalition that all hospitals and emergency management and public health departments, and I'm missing one big player in there. We have this regional approach, their healthcare preparedness consortiums. They really are looking at this at regional levels, and we are absolutely dialed in and connected with them. I will say we have also reached across the river to have discussions with their the similar side, I'm searching for the word. Same type of healthcare coalition on that side. They're called HERCs. So I think those conversations will be happening and have started at the regional level. And I think you're really thoughtful to think about how that capacity is stretched across the whole healthcare system. So thank you for that question. I want to address your question related to the census tract data. And you mentioned north of 94. There were no cases. So I'm curious if you're just kind of hovering over that whitened area potentially on the map. Is that what you're referring to, Supervisor Hall?
Yeah, I was just curious because it seemed to show no cases. Maybe I was running it wrong.
Yeah, it's a little tricky, and I will say I am not an expert in that census tract map, but we can absolutely look into that, because I know if you do hover over some of those darker shaded areas, you will see the rates are very high for certain areas of the county. I just, before this started, I wrote down rates. So remember, rates are a case for every 100,000 people, and there are census tract codes that are as high as up to 225.9 cases or as a rate. So again, rates are something we can look at, but we can try to make that data more easily digestible. And we have talked with Adam, the PIO, about that as well.
Thank you.
Yeah.
I have a couple questions, Mr. Chairman.
Go ahead.
Kelly, you're doing a great job, you and your team. Thank you so much for all the hours I know you're putting in. I've heard great things about you too from a lot of my constituents, so thank you. I have like 3 issues or questions that I'm wondering about. Is it possible on the dashboard to get data on hospitalizations as well? And what I'm wondering specifically is if we run out of beds here, or typically, because I've been a resident here a while, I know if a complicated case at Hudson Hospital, I get shipped to Regions, right? So if Regions suddenly is at capacity, then what do we do if we have people that are critically ill? That's one question, so you can start with that one. Then I have a couple more.
Sure, that's a great question. And there is a system called Wisconsin, well, we refer to it as Y-Track, and all of our emergency managers across the state have access to that. And that Y-Track system is completely for hospitals to report, excuse me, their bed capacities. It's not a public-facing system, but I think we did have this conversation with CEOs this morning about reporting of hospital systems. So I think you will see that in, give me a little time, but let's shoot for the stars and say the next 2 weeks. Don't hold me to it if it's not out by then.
The other question I had was related to the guidelines, and because it's an advisory, obviously, how do you enforce contact tracing and some of these other things, which is, I think, why it's an advisory and not an order, if I understand what I've heard. There was a fair amount of misinformation that was floating around. People, please don't use social media always as your source for news. But I'm wondering if the new PIO, who's been on the job a whopping less than 1 week, can really help us and your team get information out there so we can start to be ahead. I think in the absence of some of this, there's a lot of people confused. A lot of people are scared for a number of reasons. And this is nothing against you at all. You're busy doing all of your other stuff. But I see the need for more communication about, like, reminding about guidelines, reminding about this. I know I've had people staring at me when I wear a mask, like I have 3 heads. I think we need to talk about empathy. It's not the mask. I'm wearing it for you. Exactly. So I think we could do, now that he's here, let's make him really busy, have him help you. And then I had one other quick question. Contact tracing. We're still doing a ton of that. Did we get any of the state employees that are the people that the state hired, or how are we doing it?
Great question. So we have been given the options as local health departments to either work within our own system and hire our own people, or hire or give it all to the state to do contact tracing, or do a variety of both. And do a mix of both, hiring your own and using the state. I have just heard nothing but frustrations from local health departments related to the kind of time sensitivity and results that they're getting in utilizing the state contact tracers. So I'm careful about that, and we haven't made a decision moving forward. You guys all know I get a new boss on Monday, and excited to hear his thoughts and see where he wants to take my recommendation potentially. And we definitely need to ramp up our contact tracing efforts. It is not going away. It is going down. There was a time where we saw less contact tracing when people were staying home. They had a lot less contacts. That is not the case anymore. We're seeing those high and medium risk contacts get very big very quickly. So I don't have a great answer for that tonight, but we can definitely update you at the next meeting at our plan on what that looks like. And I will say, Administrator Thompson and Mr. Kenwit have offered the PIO to us. We have met in person, and we also met again today, and I am just looking forward to working with Adam. He's super smart, and I can tell we're on the same page on a lot of stuff. And as I've said, communication has been tough through this. We're a small health.
Right.
So,
right, exactly. And it's again, nothing, and that was a slight of you. It's just, you're trying to keep your plate spinning, but thank you.
You bet.
Supervisor Hanson.
Well, I'll start with that misinformation. I had quite several constituents call me who were business owners, and this is before the holiday weekend, who were alarmed that they had heard that the county in big red letters, was going to shut them down before the holiday weekend. And I made a call to Mr. Thompson to confirm that he didn't have the authority and that nobody was cooking that kind of a plot. And then I went and had coffee with the owner of our local bowling alley and got a hold of a person who is an officer with the Tavern League and made sure that everybody understood that that's just not so. We have to do a better job communicating to the public so that they know we're not going to interrupt economic development in a time when we're trying to repair the damage that's been done by this COVID epidemic. We can't forget that the very nature and character of our communities is Main Street. And Main Street in Wisconsin is our restaurants and our bars and our tourism. And if we forget that, then we're really going to start going down the drain in a hard way. So let's please get the communication out there. Let people know what they can expect as they're trying to do business. And I'm not going to overlook the fact that this is a deadly disease and people could be dying, but at this moment we've already established that people aren't. Not at the rate that we were fearful of a month ago and 2 months ago. So please, let's continue the good work we're doing on this communication, and I applaud Mr. Thompson on his hire, and let's reach out to these business owners and the professional associations like the Tavern Owners League, and I don't know if there's a gas station owners league, but we could communicate with the businesses better too. So thank you.
Go ahead.
Thank you, Mr. Chairman. One thing that I would suggest, and I learned this when I was in Superior and we had the train derailment. The best venue for contacting businesses are the chambers of commerce. They have direct connect with almost every business in St. Croix County. We have chambers of commerce which are extraordinarily active and engaged with their business owners, large and small. So my suggestion would be for the public information officer to contact those chamber directors. That would be our best resource in direct contact with all the businesses in the county.
Thank you, Supervisor Ard. Supervisor Hall? Sorry, Anderson.
That's all right. I guess the one question I have is, have we seen an increase in hospitalizations? Last I heard there was 2, and the last it was published there was still 2, like quite a while later.
So I think the question was related to hospitalizations.
Yes, that's correct.
It is just pouring rain here in New Richmond, and I'm in a room and it's really loud. I don't know if it's pouring there. So what I do know related to hospitalizations per my call with the CEOs this morning is that we have had one hospital, and I try to be protective of hospitals. I don't call them out by names. I hope you guys are okay with that. We did have one local hospital that has had 3 COVID patients, not St. Croix County residents, that have, there's one currently in-house, one that got discharged yesterday after a 30-day stay, and then there was another one that was also discharged after being on a ventilator in the cities for 11 days. So we did have 3 in that specific one, now currently 1, and then we do have 1 other in-house hospitalization in another healthcare facility, and I think they had a maximum of 2 and now they're down to 1. So pretty low numbers.
Supervisor Achterhoff?
Yeah, I just have one more question, and I'm going to be playing devil's advocate. If it gets really bad, do you have a plan so that we can successfully work our way through it? I mean, right now we can't enforce anything. What level does it have to be at or get at? I don't want to know numbers, maybe percentage. I mean, is there something there so that if it gets like New York, we can do something to start bringing it down?
Yeah, I think I'll defer this question to our Corp Counsel.
Go ahead, Corp Counsel Cox.
Okay.
I'm half kidding, but half not.
I'll let you answer the first part of it.
Okay. So I know you guys mentioned a little bit talking about, the hiring freeze and different things to try to help reduce our overexpended budget already. I totally understand that. I think we would be asking for flexibility with that, especially in public health, because we do have such a small staff and we are going to need more people. And we also have been told by the state there are actual dollar amounts now that we can tap into. So I hope that will not be an issue for limited term contact tracing efforts. I do not want to get to a spot where we ignore our duties for contact tracing and just hope for the best. I think there are probably parts of the country that have done that. And to me, that is just not good public health and no education to these patients who have it or people who have it is a road we do not want to go down. I like your question. I think it's related to, is there a certain trigger we're going to hit when we know we're there? And I think those conversations are going to continue with our hospital partners because we need to hear from them just as much as they need to hear from us. And when they reach capacity, I know they are all long-term planning and putting plans in place to make this a sustainable response, right? We're not even going to be through this in 2 months or 3 months. It is going to be 18, 24 months down the road. And we are thinking about that and planning for that.
Just very briefly, we have analyzed the court decision, and pursuant to that decision, there are certain limitations that will be evident on the local public health officer. But one thing we know because of that decision is that without an underlying ordinance that would create some enforcement mechanisms, even though the local public health officer has the authority to issue orders, they would be unenforceable. So we have a draft almost ready to go in the event that we need it. I hope we don't need it. I think it would be a good idea for the county to have it in place. And one thing I would emphasize is that any order by the local public health officer, we wouldn't be looking at a safer at home type order. We would be looking at a narrowly tailored order that would give the public health authority the tools to to stop whatever's going on, be it COVID or some other communicable disease. Like I said, I hope we don't get there, but we have a draft ready to go. The ordinance will not have any specific measures, but it will create enforcement mechanisms if and when it becomes, necessary to do that. And we hope that that's not necessary.
And just let me add, I think I told you guys this last month, but I went to my college education to be a nurse, not criminal justice. I do not want to take a heavy hand at this. We have worked, as our slide showed, we have worked with over 13 businesses to date when they have had positive cases. Lori is a fantastic people person, and not that that matters a ton, but she really knows the ways through this to really work with the businesses to say, hey, we're not going to, this isn't about shutting you down. This is about keeping your family at your business safe, your families at home safe, and your customers safe. So I really, I'm just going to say, I'm really frustrated that message got out, that we were looking to become an enforcement mechanism. And that's all I'll say.
Supervisor Burning?
So I got a question. In one hand, we're being told that there is no ordinance being drafted, but there is an ordinance being drafted, just waiting to come in front of us. I guess my question is, normally wouldn't the request for an ordinance come from the elected officials for an ordinance and work within committees to bring that ordinance to the board and then put it out for discussion and then a vote? Maybe I'm mistaken, but I guess I'm hearing mixed messages, and I can understand why there was concern out there, because my Thursday and my Friday and my Wednesday and my Saturday and my Sunday were pretty well shot. And I would agree with you, it's frustrating, but I'm trying to understand where this is coming from and where it's going to go from here.
Supervisor Hanson?
I'm right there. That whole thing came up in a way that I was surprised by, and even though perhaps it had the very best intentions and the most sound legal basis, I would have liked to have been involved with the conversation.
Well, the one thing I would say, it's not unusual for staff to generate documents, ordinances, and other resolutions that are suggested. When the decision came out, there were numerous meetings about what counties are doing. Counties are drafting, are being left without any tools, so to speak, if it becomes necessary. This is like any other ordinance that's drafted, not necessarily initiated by committee, but was initiated by staff discussion about what do we do in the event that we need to put an order in place. And so that was the genesis of the draft ordinance. The draft ordinance doesn't, the ordinance that's being drafted does not specify what restrictions the county public health officer or the county board will impose. It simply creates a basis for that if there's that certain situation, so that that the public health officer needs to take any action necessary to prevent and suppress communicable diseases. So that's my explanation. It's not unusual for a staff member to initiate something like that.
And I just want to be clear. These conversations were happening across the state, not independent at St. Croix County. So I appreciate Corp Council's, discussion of that. But I also want to be clear, this wasn't Kelly Ingen, the health officer of St. Croix County, coming up with some language by myself. This was Corp Councils across the state. This was health directors across the state. And it was also WCA, Wisconsin Counties Associations. So I just want to be clear on that.
Yes, this was a discussion statewide amongst all 72 counties, how best to be prepared and to be ready if needed. And so the discussion regarding drafting this ordinance is a case of being prepared in case it's needed. It has not been agenda'd for any committee of the board nor the County Board of Supervisors. Just like other draft ordinances and reports that are prepared at my request in the case that it's needed. And so then we're not scrambling at the 11th hour trying to draft reports and ordinances. And so it needs to be very clear that this has not been part of any committee agenda or county board agenda, nor will it be until I am so directed.
I appreciate those comments, Administrator Thompson. It's far easier for folks sitting out there on social media to take pop shots at the county and criticize us. So I appreciate that information. Thank you. Any other comments, questions? Yes, Supervisor Hall.
You need to unmute.
Sorry, I'm muted. I would like to take a minute to thank both the health department staff and the corporation council for being proactive in having us ready, because I think they know the legal aspects of why the Wisconsin Supreme Court ruled as they did and what needs to be done to make sure that this is done through a rules-making process, which I approve of. And then secondly, because the health department people are probably best positioned to know what they need to have the lightest touch to be able to do this. So in general, I love the idea of, community volunteering to follow along with guidelines. But I also know that we give our police department radar guns and the ability to write tickets if people don't listen. So I think this is a case where we probably at some point will need to be coming back to either the committees or the full board. And I just want to say thanks again.
Okay, thank you. We'll move on to the next business item then, and that would be the resolution declaring an emergency and ratification of proclamation declaring a state of emergency due to riots and civil commotion in adjacent communities. Pat?
Yes, thank you, Mr. Chairman. I'll start off on this item. In your packet, you have a resolution which is calling for ratification of a proclamation which was declared last Friday afternoon, declaring a state of emergency due to riots and civil commotion in adjacent communities. And this arises out of the May 26th incident in Minneapolis with the death of George Floyd. And it became apparent to the sheriff's office and county administration late last week that some of the activity across the river potentially could spill over quite easily into St. Croix County. And upon the advice and recommendation of our sheriff, we notified the county board chairman, and the corporation counsel's office assisted in the drafting of a resolution that is in your packet. And we are calling for the board's confirmation of the proclamation that was declared last Friday afternoon. By state statute, the state of emergency can only be declared by the governing body, but in lieu of the body being able to meet immediately, it allows for your chief executive officer, in this case the chairman of the county board, to sign and approve and proclaim a state of emergency, and then the governing body is asked to take up this matter at its next meeting. And so that is why we're here before you this evening asking for your action on this resolution. One of the questions, before I ask the sheriff to speak, one of the questions that the board might have will be what is the duration of the declaration? The duration is for the period of the emergency shall be limited to the time during which the emergency conditions exist or are likely to exist. And so upon consultation with the sheriff and recommendation to the county administrator, the declaration will last until such time when the law enforcement feels the emergency has ceased to exist. At this time, I'd like to call on Sheriff Knutson. He may say a few words regarding this declaration and what led up to it and what has transpired since the declaration on Friday afternoon, and then the board can ask questions. Good evening, Sheriff.
Thank you, Administrator Thompson. Well, first let me say the death of Mr. Floyd was tragic, sickening. Really at a loss for words as to how it could have happened, why it happened. So obviously my condolences go out to that family. Again, something that should not have happened, and plenty of cops have no idea how it did. So, but because of that, actually that was the flame that started the powder keg. It didn't just start last week. So we got into a state of heightened awareness once the protests and rioting started over in the cities. We began to hear some Facebook chatter about Wisconsin, western Wisconsin, some communities. They were vague. So along the lines we had worked with the Minnesota Fusion Center, Wisconsin Fusion Center, Wisconsin Emergency Management, Department of Criminal Investigations out of Milwaukee. Many entities and a lot of conversations over the last week have taken place. Because it got close to here really was because of the officer that started this lives over in Oakdale. So his house became really a lightning rod for protests, and from our border is about 8 miles away. So even that Thursday night when the protests started, we were getting reports of groups of individuals just across the river. And of course we would have cars that would pull in and mention to the officers around the Hudson area that they had heard that there was plans to come into Hudson or come into western Wisconsin. So that Thursday night we had bolstered staff that night in western St. Croix County to include not only just Hudson but the St. Croix River crossing. We had about 15 squad cars patrolling the area for as much presence as we could, and if there was anything that maybe there was folks watching our movements that they would see a lot of us. So over the next 72 hours we had, on a given night, Saturday I'll speak specifically of, we had over 30-some squad cars in this area. I believe as the other agencies within the county bolstered, we had about 80 squad cars available to us. We took what I believe is a proactive approach to at least a deterrent, and in hopes of helping to ease some tension or anxiety with as many squad cars as we could. Obviously, we don't have 80 squad cars within St. Croix County. So I utilized mutual aid and requested from the region that I'm a part of, which is 9 separate counties. We had 15 different agencies that responded. Several other sheriff's offices, police departments. There was 11 agencies out of county that came in here to assist us. Which is why when Sheriff Starry in Washington County requested assistance, and we were under mutual aid pact under Wisconsin Statute 175.46, and Sheriff Starry has been an ally and an assistance to us on ERU calls on the river, and so that is why we sent officers over to assist him with his civil disturbance in Washington County, again 8 miles from our border, on Thursday night. Over the next, again, 72 hours, I was on the phone with a multitude of different offices, agencies throughout Wisconsin, Minnesota, specifically in Minnesota. Dan Starry was a wealth of information for me, as he's a part of their Minnesota group, their fusion center, their information center. So I was getting some information that was very useful to our staffing and when to ramp up, when to pull back a bit. So now we're into another week. Madison is continually calling for assistance. Milwaukee is still in tough shape, and the information, the classified information that I'm getting is that some of these things will not end in the very near future. They seem to be, the protests seem to be in it for a duration. When that end is, I don't think any of us know. I wish we did. I have seen protests planned till June 13th on a schedule. Now, protests are wonderful First Amendment freedoms, and I wish them all the very best and safest of times. Obviously, they avoided a tragedy on Sunday with that semi, so we hope for all the best for everybody involved in all those. But because of that, sometimes some individuals get in there that no longer want to remain peaceful, and they have their reasons for that. So I don't know when this declaration may need to end. I don't know what to expect coming in the next coming weeks. Again, some classified concerning information for this weekend, not for St. Croix County. But again, there's always that concern that to get to the flashpoints of Minneapolis, St. Paul, there's a concern of coming through Hudson and on the interstate. But we did see an increased activity. Over the weekend, the hotels were full. I anticipate that there were those that participated in both peaceful protests, and we also had one gentleman that we had stopped that had got into a high-speed chase in Washington County, and we stopped him on Saturday, or came across him on Saturday, and he had a car full of items from some looting, and he had local ties. So we are seeing some things that come over the border, but again, we'll continue to be vigilant. We'll continue to watch what's going on over there and react appropriately, and surely do our very best to prepare and keep the citizens safe here. So.
Thank you, Sheriff. Are there any questions?
Supervisor Brennan.
I'm assuming, which is a bad thing to do, statutorily, we have the right to rescind this emergency at any time if we're giving him almost carte blanche with no end date. Let me rephrase that. Do we have an end date?
Pardon?
Or do we have the power to end it if we need to?
The statute is vague. I'm going to let Scott speak to this, but it says the period of the emergency shall be limited to the time during which the emergency conditions exist or are likely to exist. So Scott, I knew this question would come up about duration.
So if for example, if the board, even though the conditions still would exist, hypothetically, the board would still have the authority to rescind its previous action. So the term of the declaration or the state of emergency is during the times in which the emergency conditions exist or are likely to exist. Notwithstanding that, the board on its own action could rescind this resolution.
Thank you, Scott.
Okay, and is that the same statute that this is under that gives us that authority to do so? The same, the 323?
Yes, the statute actually is silent on the rescinding, but it's my opinion that the board is able to do that. The board is this is something that the board is able to do within its powers, because this evening you don't have to accept this. So it logically flows that you have the authority to rescind it in the future.
Further questions?
Yes, Supervisor Hall.
Supervisor Hall, go ahead.
Yes, wouldn't it be just as simple to put in a nominal period of, say, 2 months as a sundown on this resolution, and then have to have it reapproved at a regular interval by the board? That way we have a closed end. I'm uncomfortable with an open-ended time period.
Supervisor Hart.
In reviewing this and looking at actions when we have had high-profile cases throughout this country in the past, we are not through this. We have peaceful protests which are starting in Minneapolis, St. Paul, but we still do not know how the country as a whole, or Wisconsin in western Wisconsin or in Minnesota, is going to respond once we start hitting the trial phase of this journey. Having an order such as this in place means that our law enforcement, our emergency management, can respond immediately. They're not waiting for the board to convene in order to reapprove an order that should have been in place. It has the language which ends it once the emergency ends. I don't see this emergency situation at hand ending until we have a final verdict within the 4 cases that are going to be looked at. This is going to go a lot further and longer than anyone currently is anticipating. We need to be prepared.
Supervisor Achterhoff.
My comment I had a bunch of phone calls because everybody thought that because of this proclamation, everything was going to close again. And they said, oh my God, we just opened up, and now the communication has to be better as to exactly what this is and what we're going to do with it. I agree with it, but there was definitely confusion, at least in my district, in regards to, okay, are they going to close my business? I just spent all this money to get stuff to open it, and now it's going to have to close because of this emergency. So, yeah, the communication has got to be clearer as to exactly what is happening.
Yeah, these are 2 separate, totally separate items.
But people were not getting that.
I know. I've heard that too, Judy.
Supervisor Cook.
Thank you, Mr. Chair. And I also want to say thank you to Sheriff Knudsen and your officers for all the work that you've done over the last weekend. I'm sure it's been very stressful and a lot of work, so thank you for that. I do have one question for you, Sheriff. There's a lot of language in the emergency declaration that describes what an emergency power is, but would you be able to give the audience and the public some examples of what kind of activity might take place in an emergency scenario situation versus, if we don't have an emergency declaration?
And maybe Scott Cox can follow me up with this, but I'm thinking of emergency road closures. If we know that there's a march coming that may impact the interstate, we have to divert traffic, clear streets of public in the middle of the street that is impacting ambulances or fire trucks or it's movement of and resources that we'll be able to get. I think more it also, because it's all encompassing, that it would also help us with county maintenance and getting those vehicles to allow us, or getting those vehicles to assist us in closing roads and the impactful things. Mr. Cox, any?
Yeah, I would agree. And potentially if the situation gets so dire, possibly even a curfew. But another thing that this would do, it would create an avenue, if necessary, I want to emphasize that, to call on the National Guard to deploy, but that would only be if local resources were exhausted.
And if I may add to Mr. Cox's, there was confusion on a curfew this last weekend. Some people had thought because certain municipalities within Washington County had done curfews at 8 o'clock, and then out came the information of our emergency declaration that we were also under curfew. There was questions of a wish for a curfew, and I was so far from a curfew. There was no indication, there was no valid threat that we were able to, through the help of all those fusion centers and information, pin down to say that, yep, that threat is coming. So, again, I will resist to any means, unless at the dire end, for any curfew. I surely don't think it was warranted this weekend. There was talk of the National Guard, and as Mr. Cox mentioned, some of the requirements for that are actual threats, possible. Well, you're in the middle of an incident. You no longer have the resources. You've expended all your resources. The National Guard is the last in and the first out. They are the last line. And again, there was some concern this weekend when there was talk of National Guard, and we had not met any threshold for that, for their involvement.
Point of order, Supervisor Fiedler.
We don't have a resolution on the floor, so I'll make a resolution. I move the adoption of the resolution as described earlier by the county administrator and found on page 20 of our agenda packet, declaring an emergency and ratifying the proclamation on the same subject that was issued last week by the county chairman.
Thank you, Supervisor Fiedler. We have a second from Supervisor Hanson. And continue with discussion now. I believe Supervisor Tomczyk had a question.
I believe that Mr. Cox indicated what the possible resources that may be pursued, but I guess my concern is the duration issue. I don't believe that, I think that we would need to have, if this continues in duration, we would need to have some type of definition for what the emergency conditions are that are existing. I don't foresee that we're going to be able to continue to operate under an emergency for the duration of the term that a trial may occur over these officers, or one officer, or possibly the four. I believe that this would have to be something that we'd have to possibly review. Things may potentially die down and then come back up again as coverage again occurs as trials and court hearings start over there. So I don't know that it will necessarily be an emergency during the whole duration of the time until we see something happening with those defendants.
I just,
feel free to correct me if I'm wrong, but this just gives the authority to be able to enact things like this. It doesn't mean obviously that that anything has to get done. It's just if something comes up, it allows the ability for the sheriff's department to react to it quickly without having to call an emergency meeting, et cetera. And then I guess my second question, worst case scenario, I mean, this is the avenue to, Chicago, Milwaukee, Madison, where I'm sure some people came from, and something happens. Two National Guard related questions. How long would it take for like a Wisconsin unit to get here? And would Minnesota like send units here if they were quicker and it were dire?
Answer to your first question is it depends. It depends on what specifically we are requesting from the National Guard for Wisconsin. I'll finish that question first. That would take a discussion with the adjunct general. And again, we had those talks on Saturday, not with the adjunct general, but with, I think, one of the chief of staff in the governor's office I was speaking with. Again, it would depend on where they were deployed from. And as of today, their availability, because they are deployed down in Milwaukee and Madison right now, there may be a limited access to them. And as far as Minnesota, that would not, though there has been a requested, what I believe is an EMAC request across state lines, but that was Minnesota requesting to Wisconsin. But because we have our own issues here, I don't believe that was ever on the table, and I do not believe Wisconsin has reached out to Minnesota, and that would take some time.
Supervisor Hall.
Yes, so I'm not sure of the parliamentary procedure here, but I would like to propose that we amend the document around lines 62 to 64 to include language if we cannot agree that there needs to be a close date of some specific period, that we verbally or that we formally write out council's opinion that the county board has the right to rescind this on a vote at a regular meeting. I'm just not comfortable having an open-ended ordinance for emergency powers. It's just, I'm just not in favor of that at all.
Okay, are you making that motion? If so, is there a second to that motion?
I move that.
I heard, okay, so that's from Supervisor Hall. There is a motion there. Is there a second to Supervisor Hall's motion to amend? Seeing none, the motion dies. Further discussion? Supervisor Connor.
Thank you, Mr. Chairman. I mean, I'm in agreement with that. An emergency declaration like this has to be able to be made. I think it's very, very important to be able to move on things as quickly as possible. The only issue I have with some of these things is I think after the declaration that we should really review it, or at a minimum be totally kept informed about what's going on as elected officials. We have to remember that the people that we're putting in these positions are under our control, and we need to ensure that we keep that in mind as we're also kept lockstep with our constituents. So if they don't like what we've done, we can be ousted. It's different for anybody that's administration or staff or anybody else. So I'm just looking at the condition, and if we wanted to do something where it was ratified, or at a minimum have something in that for the information that we're made aware of it at the very time anything's going on. Is one of the problems we get is without that knowledge, we have talked all night about instances where things are happening behind the scenes and then we find out, and I just think it's to our advantage.
Supervisor Fiedler?
I'm very sympathetic to the comments that were just made. And as chairman of the Public Protection and Judiciary Committee, I'll simply say that the sheriff's office was in very close and intimate contact with me over the weekend, briefing me on what they were doing, and we knew this was going to come up within 72 hours, and we'd get a full discussion as we've had. I'll note that Supervisor Hanson and I were at a meeting this morning of the CJCC, Criminal Law Subcommittee, and we had an extensive discussion of this then, and in 2 days the Public Protection and Judiciary Committee will be meeting, and this is a large part of our agenda as well, to review in greater detail with the sheriff what's happening, and I'll just say establish lines of communication that are as broad as we possibly can make them, and I'll certainly commit to the entire board that we will regularly ask questions on this topic of all those involved in the emergency management system, including the sheriff, and report promptly to the board.
Okay, go ahead.
Mr. Chairman, my biggest concern to putting an end date on this and having it to where the board needs to meet would be if something were to happen in say, a violent situation, a riot, or other type of disturbance that would disrupt our communications or disrupt our ability to meet as a board, therefore taking away de facto by default with an end date the sheriff's ability to be pliable in a situation where that may occur. If that's the case, having an end date would not protect us, and in the case where there is no longer an emergency and we are able to meet, I believe, Mr. Chairman, it would be to our best interest to allow the sheriff and his department to keep an eye out, give public protection continuous updates, including, or mostly the chair, so that he can stay busy. But in any case, I think it would be advantageous to us to look at the worst case scenario, which is this county building is not available to meet at and our communications are down. Therefore, with a end date being put on this emergency order, it would jeopardize our county.
Thank you. Further discussion? I believe we're ready to vote at this time then, so all those in favor?
Aye.
Opposed? Carries
Nay.
unanimous. I'm sorry, there's an opposed?
Paul, nay.
Okay,
No.
one opposed. Thank you. Motion carries. Next item is the amendments to the bylaws suggestion, and that would be Supervisor Long.
Thank you, Mr. Chairman. There were 5 changes to the bylaws that were recommended by the Administration Committee, and I think if you page down to the very end of your board packet, I think it's...
Will you bring it to the floor first so we can have a discussion on it, and then you can...
Oh, I'm sorry. You need a motion. Okay. Is that
Are you
correct?
so moving? Yes.
I am moving to approve the 5 amendments to the bylaws.
Second.
Okay, we have a motion and a second for the changes on the bylaws and discussion now. Go ahead, Supervisor Long. Thank you.
Thank you, sorry. So the summary is right, starting on page 72, all the way to the bottom of your board packet, if you want to take a look at that. I'll just run through these 5 items fairly quickly. The first item, meeting place, dates, and times. We had discussed about the morning meetings of November, December, January, and February, and decided to leave those intact in respect for the supervisors who have to travel from the east side of the county. In the wintertime, we all know at nighttime when there's snow and ice, it can be a little challenging. So the morning meetings would be beneficial to them. So we kept that in place. The time previously was 9 o'clock. That was changed a couple of years ago to 8 o'clock. We just kind of arbitrarily thought 8:30 might be a nice compromise, just to give you a little more time to get in here on a Tuesday morning. The second item, and I'm going to run through these and then we can discuss them. Second item was the order of business on the county board meeting, or our agenda, and basically we are moving the annual department reports down in order to move the business items up. And that was really in respect to our public who comes to listen to our discussion and comment on our business items so that they wouldn't have to sit through the annual department reports. Not that they're not important, because they are. We need to hear them. But the public may not be particularly as interested in the business items, so we're trying to move that up on the agenda. The third item is probably the one that we'll want to discuss in a little more detail. We added item F on number 5 in public comment. So item F is basically an addition where the public time or comment time period will be limited to no more than 30 minutes per meeting, and that can be extended at the sole discretion of the chair. Basically, the logic there was sometimes we have certain business items that are a little contentious. We get a lot of public comment, and that can go on for quite some time, really extending the time of the meeting, and a lot of the comments can get a little repetitive. So that was the idea there, to put some sort of a limit in there. 30 minutes was a little arbitrary based on what some other counties have done, but we did want to make sure that we had the discretion to extend that as well. The next item, Council on Aging and Disabilities, there was the last sentence of paragraph A that basically, based on state law, was not applicable anymore, from my understanding. If you need more detail in that, I'd have to refer that to the county staff. And then the last item was very simply to modify the St. Croix County Fair Board for representation from 3 supervisors down to 2. So that's kind of a summary of the 5 changes that were recommended. Mr. Chairman?
Thank you. Discussion. Supervisor Cook.
Thank you, Mr. Chair. Mr. Chair and fellow members, if you look through your packet, you'll see that I was the one supervisor on the administration committee to vote against the bylaw changes. That is because of item number 3. I have no concerns with the other changes, but item number 3, which talks about limiting public comment, I do have concerns about. I think as a public body, it's our responsibility to listen to our constituents if they show up to share their thoughts. Unfortunately, I don't think it happens as often as it would be beneficial to us to understand what they would like, how they would like us to vote. So the board already has, I believe, a 3-minute time limit on public comment for each individual. So I just don't think it is right for us to be limiting public comment if 50 people show up or 100 people show up to share their thoughts. I think they should be allowed to do so. I know that at the committee we did talk about, at the discretion of the chair, being able to extend that public comment time. I think that at times that could create a scenario where the chair unfairly is put in a position where it looks like maybe they're supporting one side or the other of an issue, and so I'm not sure that it's fair to put the chair even in that position to have to make that discretionary call.
Supervisor.
Thank you, Mr. Chair. I'd like to talk about that third article as well. I, as the HHS board chair, earlier this year we had public comment for an hour and 50 minutes on a vaccination issue. And then proceeded to have another 2 hours meeting after that. I think looking back on it and seeing the large amount of people that probably wanted to talk about one individual thing, I'm just wondering if and I don't know, Mr. Cox, maybe you can help me out on that. If we've got 5 or 6 people that are going to talk on the same item, is there a way that we could get that small group together and just have one person speak on behalf of those folks to cut time down, and then allow statements to be handed in at the end of public comment? That's my first question. I have another one later.
I think that's possible, although it would be very difficult to write a rule and to basically get people to cooperate about their own public comment. I think the administration of that would be pretty difficult.
Okay, and then with that, Mr. Chair, is there a way that we can add something into the wording that it would be up to the chair to extend public comments more than the 20 minutes that's allowed?
I believe it's 30 in there, but yeah.
It actually does allow, the rule actually does allow for the chair to extend.
And Scott, is it at the point of 20 minutes that he can extend it, or does he have to let folks know before they get going that it will be whatever?
So the background contains a 20-minute example from another jurisdiction. Supervisor Osnes, the actual change in the rule is a 30-minute limitation with the chair being able to extend it at his or her sole discretion.
Supervisor Burning, you were, okay, just a moment. Were you not done? Okay, Supervisor Burning.
So yeah, Mr. Chairman, I just want to say that my opinion is, this is my opinion, that you as the chair have the ability to curb that public comment if it goes on the same subject matter 3 minutes over and over again. I would feel like it would be within your purview to curb that if it's getting to be an hour and a half on the same subject and the same statement being made over and over. With that being said, Mr. Chair, I would encourage us to not limit what the public say. Their time to comment to us, I think it's vital that they get that out and they feel like they've been heard. And it is our duty as elected officials to sit here and listen to it, whether it takes 3 minutes listening about nitrates or it is 3 hours listening about another subject matter. I believe it is important for those voices to be heard. And so that's what I have to say, Mr. Chairman. Thank you for allowing me to speak.
Supervisor Achterhoff.
Yeah, I've been on here for 6 years, and I think less than 5 times have we had an extensively long list of people that wanted to speak, and that was on an important item where they got brought down to 2 minutes, but we let everybody speak, assuming that you weren't continuing to speak. So I don't think it was a problem to begin with. So I don't understand why we're doing, literally in 6 years, less than 5 times, and it was about an important issue, and we did let them continue to talk. So I'm against any change that would any kind of limitation. As to total length of time, and when there were a lot of people, like I said, instead of 3 minutes, we went down to 2. And it just teaches people to be concise, which I'm not sometimes, but.
Supervisor Tomczyk.
Going off of Supervisor Achterhoff, if we had something within there that allowed the chair to reduce the maximum to 2 minutes rather than 3, if we have a very large amount of people who wish to speak, then that would, again, just enforce the conciseness issue, but also allow everybody to be able to say what it is that they feel that we need to hear.
Supervisor Hanson.
Flexibility here is the key. We had a night where we had people who were deeply concerned. You had Ginny Drath tonight talking about water. She was one of the people who was there that night. And I, as the chair of community development, allowed everybody probably 5 or maybe more minutes to talk. But I'd invited people who owned large dairy farms to come as well. And what we had effectively was a community conversation. And it was a healthy conversation. You have to have the ability to let the chairperson have flexibility to set a limit and to add a constraint that somebody might come in and say, oh, now hold on, you only get 30 minutes. Suddenly that, as a chairperson, I'm going to feel constrained. And I don't want to tell people that they can't have their public comment, but I would also not want to have the flexibility of limiting public comment to 2 minutes if it looks like I'm in for 3 hours of, half of them saying I'm for it and half of them saying I'm against it, because that happens too. So I need the flexibility. I would rather leave the bylaws the way they are and let our reasonable chair people make their decisions based on their experience. Thank you very much.
Supervisor Long?
So one other maybe compromise would simply be get rid of the 30 minutes altogether and just add a line that says the county board chair has the discretion to limit the overall time of public comment. And then that gives them, we're not saying 30 minutes, but it gives the chair some discretion depending upon the issue.
Parliamentary inquiry. Can we accept a motion to amend this, or does this need to get sent back?
We can amend it, yes.
Through a motion, correct?
Correct.
May I make a motion, Mr. Chair?
You're free to make a motion, yes.
Mr. Chair, I make a motion to take out the 30 minutes and amend that to the chair has the discretion to limit the time if necessary.
Okay, we have a motion and a second to amend the bylaws to remove the 30 minutes and add a statement that the chair has discretion for limitation. Okay, open for discussion.
Excuse me, this is Supervisor Hall.
Go ahead, Supervisor Hall.
Do I have the option of also proposing an amendment?
We have an amendment on the floor, so that's first item, but then after that's acted on, then you will have an are you proposing to amend the amendment? I'm sorry, say again?
I would like to amend the proposed amendment.
Go ahead.
I would just strike letter F from section 3.
That's not amending the amendment. That defeats the purpose of the amendment, so that I think that would be out of order.
Okay, so then my amendment would be the public comment period will be limited to no more than 30 minutes per meeting. And eliminate the part where it may be extended or shortened at the discretion of the chairman.
The original amendment was, or the original proposal was 30 minutes, and the amendment was to remove the 30 minutes and give the chair discretion.
So what I'm trying to say is it would be limited to 3 minutes per individual, but not lengthened or shortened. I don't know if that made sense.
I think that has to be addressed after this amendment. That doesn't amend the current amendment. It actually defeats the purpose of the amendment.
Okay, so I agree, and we'll act on your proposal after we finish on this amendment here. So the amendment on the floor at the present time is to eliminate 30 minutes from item F and authorize chair discretion. Further discussion. Supervisor Cook.
Thank you, Mr. Chair. I have a question for Scott. Is that essentially what we have right now? In the current state that we have where folks have the opportunity to speak, but then the chair basically has the power to manage the meeting? So are we changing anything from the current state if we were to amend the item to this? That's what I'm wondering if we need to.
Can you scroll up a bit? I believe that the chair has the inherent authority to limit public comment for the efficient operation of the meeting. I think what Supervisor Burning's amendment to the resolution doesn't exactly change that, but it codifies it in the rules of the board, which may be useful for the board chair in the event that it becomes necessary. So the answer is it doesn't fundamentally alter the chair's authority.
Supervisor Cook, you're happy with that?
Okay, thank you.
Further discussion? Okay, I believe we're ready to vote on the amendment proposal, which is to drop the 30 minutes, allow chair discretion on the length. And any further discussion? We'll vote at this time. All those in favor signify by saying aye. Aye. And opposed? It
No.
carries. Oh, one no. Thank you. Okay. Further discussion? If no one has further discussion, then we're ready to vote on the main. Well, are there other areas that I think we wanted to address the 8:30 or 8 o'clock start time? Did somebody want to discuss that before we could?
No one brought it up.
Okay. All right.
We start at 7.
Okay, I guess we're ready to vote on it then. So at this time, we'll vote on the, let me restate it here, the resolution of the bylaws as amended. And all those in favor at this time signify by saying aye. Aye.
Aye.
And opposed? It carries. Thank you. No, I've lost my agenda. Okay, business items are finished, so a request for future agenda items. Supervisor Achterhoff.
Yeah, I guess I want it so that the public can hear too, is I would like our board to look at some kind of assistance that we could give our small businesses in this county. Because Chippewa County has a COVID-19 business assistance disaster relief loan program that they put $300,000 in. And I assume they use part of their fund balance, and I know there's other counties also. I don't know if this has to come through a committee or whatnot, but I want to be able to help our small businesses survive, because that's what's keeping this county going. And I don't know what we have to do, but I feel it's vital that we look at it and do whatever we can for them, and the sooner we do that, the better, because they've been shut down for 2 months, and they've had to pay rent or whatnot, and some of them are in pretty dire financial straits. That is one area. That's where I got this information from, but I'm just saying that they don't, the West Central Wisconsin Regional Planning Fund, they don't make money. They get money. So, but it's the county that's one of the reasons that we have a fund balance, is to use for emergencies. And yeah, I just would like it being discussed next month.
I'm going to refer that to the admin committee for consideration. And Supervisor Burning, you had something to add on it?
Yeah, thank you, Mr. Chair. I want to look at it, would like to look more than just small business. I think across the board, we have 90-some thousand people, and I think we need to look at it as a whole, not just small businesses. So I would appreciate if that's put on to tag onto exactly what Supervisor Achterhoff said, but put it more as a whole, not just a small business. So thank you.
Okay, Supervisor Long, you have that? Okay.
I would agree with Judy too, that we should have that discussion.
Okay, that will be on their agenda. And Anybody else?
Yeah, I had something on the same line as the supervisor. My proposal was going to be a 16% reduction for small business and an 8% tax reduction for all residential. And the way I got to that 16% is it's 2 months of 12 months for the year. And I think that's only fair. We need to keep these businesses going. I think it was Judy said, she's right. We're not going to exist anymore. Thank you.
That'll also be an admin committee pickup. Okay. Any other agenda items? Okay, seeing none there, I'll Connie, Cindy?
I just wanted to mention the 2020 WCA Annual Conference is still happening as of now. It's September 20th through the 22nd in Sauk County. You probably received a mailing on this, and so if you're interested in attending, let me know. And registration, early registration would be August 14th, by August 14th, and then WCA member delegates for first-term new supervisors, it's a free registration. So just wanted to bring it up. I'll probably send out an email just as a reminder to you as well. Thanks.
Thanks, Cindy. Announcements. Dan, Supervisor Hanson.
Thank you. This is June, which is, I know there's so much going on, but this is the first time since I was elected, which now this is my 4th term. Steve Shaw is not here from the Zwald Farm bringing us cheese. It's Dairy Month. And the Zwalds are good friends of the county, and the county having participated in the water quality study. And I just wanted to say it's Dairy Month in honor of Steve, who couldn't probably be here because he was thinking of the pandemic and such. So it's Dairy Month, folks.
Thank you, Supervisor Hanson. Supervisor Achterhoff?
Yeah, just make an announcement that unfortunately the St. Croix County Fair has been postponed till 2021.
Somebody else have something else? Go ahead, Supervisor Long.
Real quick, just a reminder, I think you all received an email from St. Croix Economic Development Corporation, and there are applications for the We're All In Small Business Grants. So if you, on that same theme, if you know small businesses who are in need or struggling, there are grants that are available, $2,500. And this is a state program, so, and the information is on the St. Croix Economic Development website, and the applications will begin on June 15th at 8 a.m. So there is a program available, and so I would encourage you to make sure you get the word out to other small businesses.
Supervisor Achterhoff.
Well, just adding on to what Supervisor Long said, that I called, I can't remember her name, the gal, because she sent it out to a few cities, but not everyone. And I called her and I asked her to send it to the clerk of every single village, city, town in St. Croix County so that everyone would have this information, and she was going to do that. So.
Okay, any others? Apparently not. So the next meeting will be scheduled for July 7th. However, keep your eyes and ears open. If there's not a lot of business items, we may end up canceling that. I know everybody's probably going to be wanting to do their vacations and stuff. So on that note, I'll adjourn this meeting at 7:03. I apologize for running so long.